happened April 2022. I had actually just moved down to Pittsburgh, Pennsylvania. I had just become a yoga teacher. We were in Tampa visiting my partner's brother, and that's when the dog attack happened. It was one bite, and that was it. My first surgery in Tampa, all he did was clean up the nose, and he put plastic covering over to protect it. We went down to Miami, thinking Miami has a lot of good surgeons in plastics. One had actually mentioned Dr. Thornton's name. With Dr. Thornton being here, I don't think it really mattered where he was geographically. He was very reassuring that he could help me, whereas a lot of other surgeons I spoke to were very unsure. Dr. Thornton and Dr. May are both absolutely amazing.
Our currency really over the last 10 or 20 years has been facial reconstruction, the majority after skin cancer, with the occasional traumatic injuries, most often dog bites. The factors that made Jordan quite different were really her age and the extent of the dog bite injury, which is essentially a total nasal avulsion, the removal of the entire nose.
As she was preparing to travel to Dallas for her reconstruction, I asked her to send us some photos of pre-injury Jordan. What we saw was just a really beautiful, normal, happy girl. And when she came in person, you see this traumatized person that can barely look at themselves in the mirror. And it's a jarring experience, I think, for everyone involved.
Plastic surgeons are head-to-toe problem solvers. What makes the nose so difficult? One is it has to be accurate to millimeters. And two is it's intersecting concavities and convexities. And so those have to be accurately recreated. It has to be recreated with tissue that's a perfect color match and texture match. And so you have to bring tissue from the forehead. And for her, we had to put a tissue expander in and expand out her forehead to get sufficient tissue to make her entire nose.
So far, I've had about, I want to say 12 or 13 surgeries. I kind of have lost track. But we have a few more surgeries to go.
I think that there are certain things that need to be touched up to make her feel a little bit more whole. This is going to be the face that her children grow up with. This is going to be the mother that they know.
I would say I have kept pretty high spirits through most of it. Definitely have had my days. I do remember when it initially happened, being in the hospital and looking at my partner, John, and saying, hopefully I can help other people through this. I have people even now reach out to me, asking me questions or just saying thank you because they feel less alone in something like this.
One of the strengths of an institution like UT Southwestern is the ability of clinicians to develop a very well-defined and specific skill set, which is very much a tip of the spear approach to medical care. And our department is no exception.
I have a lot of faith in what they can do. They're really amazing surgeons.